Your knee here is sandwiched in between your low back and your hips above and your foot and ankle underneath. And you can see here that if I change the position of my hip, for example, if I turn it inwards, you can see how my knee will follow and come inwards. If I turn my hip outwards, you can see how again it's going to follow and position your knee outwards. If I change the position of my foot and ankle, if I flatten my foot, you can see how this again is going to bring my knee inwards. And so we can see very easily how the position of our foot and ankle and the low back and hips can very easily affect the knee. And more often than not, knee pain is not directly caused by the knee itself, but the surrounding areas. So in this video, I'm going to show you some of the most common causes of knee pain and what you can do at home to fix the problem. So let's get started. Hello and welcome to another video. My name is Dr. Stephen Hulme. I'm a chiropractor based in Reading and I'm passionate about helping people to optimize their health and living pain-free. Now in this video, I'm going to be talking about the knee because it's quite often assumed that the pain that you get in your knee is caused by the knee itself, and that's a very safe assumption. However, more often than not, it's actually caused by the surrounding areas, usually the low back, the hips, as well as the foot and ankle. And this is what I want to discuss in this video and also discuss how you can therefore fix it. Now, when we look at the knee, on the surface of it, it actually looks like it has 1 degree of motion, flexion and extension. It looks like it's a very simple hinge joint. However, it actually has 6 degrees of motion. It has flexion and extension, it has valgus and varus, it has medial and lateral rotation, and then it also has anterior and posterior shear, it has medial and lateral shear, as well as distraction and compression. In summary, it actually has a lot of different ways in which it can move, which means it has a lot of different ways in which the knee can become problematic. And yes, the flexion and extension is certainly the major movement of the knee. And although the other movements are actually quite small, they actually have a big impact on the function of the knee. And these movements can therefore change depending on the function of the low back, the hips, as well as the foot and ankle, as well as the knee itself. And it relies on 2 major things: the joints, and i.e. the way that the joint is moving or the position of the joint, any restrictions or malpositions of any joints in the low back, hips, in the knee or in the foot or ankle is going to affect the mechanics of the knee, the way that the knee is going to be moving. The other side of it is also the muscles, and now these two very much work together. If you have a weakness in one of the muscles that controls the knee, you're therefore going to have a malposition of the knee because you're going to have an imbalance in the muscular system where one is going to be too tight and one is too weak, and that's going to therefore change the position of the knee. And so my first suggestion is go see a chiropractor or a manual therapist who can properly assess you, to assess these joints in your low back, your hips, your knee and your foot and ankle for any restrictions or malpositions so they can be corrected first. They can also see your movement patterns as well as identify any muscles that are weak that are causing problems within the knee and therefore give you very specific exercises. Now there are 2 main muscles that very commonly get weak when it comes to the knees, and so I'm going to go through some of my best exercises for these muscles to strengthen them, which is always going to be a very good thing, not just for your knee but also for other areas of your body, but will almost certainly help with the majority of you that are suffering with knee pain. Now the first muscle to get weak or not work as well are your quadriceps. Your quadriceps are made of 4 different muscles, and these muscles will work together to control your kneecap as it flexes and it extends. If you get too much pull on one side in comparison to the other, then it's going to pull the kneecap either outwards or inwards, and that's going to cause a problem underneath your kneecap and cause wear and tear, which can produce patellofemoral pain syndrome, i.e. pain underneath the kneecap. So this is going to be an important muscle. Now the most common portion of this muscle to get weak is your vastus medialis. This is the muscle that's in the inside of your thigh. However, if you haven't been assessed specifically, then I would just strengthen all of these muscles at once. And so the first exercise that I'm going to suggest is going to be called a pillow push. And so what you're going to need, as the name suggests, is a pillow, and you're going to place this underneath your knee while you're in this seated position with your knee extended out in front of you. What you're going to do is push down on the pillow as if you're going to squeeze the pillow against the floor. Now, as you do this, you should notice that your foot should very slightly come up as you do it. Now, you're not focusing on bringing the foot up. However, that is one of the effects you will see if you're doing the exercise correctly. Now, one of the most common things that people do is they'll try and use their hip or their low back to try and get that movement and get their power from that area. You'll commonly do this particularly if you don't have the strength within your quads. So you really want to focus on activating your quads. You can actually put your hand on your quads to make sure that you're actually contracting these muscles, and make sure that you're pushing the knee into the pillow. Once you're pushing in, hold for 2 or 3 seconds and then relax, and then repeat that anywhere between 10 and 12 times. And I would suggest doing 3 sets every single day. Not the end of the world if you miss a day or two, but it's always good to get in the routine of doing exercises every day, because then you're less likely to forget. Now, there are lots of different exercises that you can do for the quadriceps, so I would just focus on strengthening the quads. You can use whatever exercise you would like, provided that it doesn't cause any pain. You can use leg machines at the gym, you can use resistant bands, you can make up any exercise that you like, that as long as you're getting stimulation and activation into your quads. So you can play around with it, but it should give you some improvement in the function of your knee, and may even decrease your pain in most people, depending on what your problem is, of course. Now, the next muscle that most commonly is weak, particularly with people that suffer with knee pain, are your glute muscles. These are the muscles that are located on your buttock, and these muscles are going to externally rotate your hip. Now, as you saw in the beginning, as I changed the position of my hip, as I turned it inwards or outwards, this changed the position of the knee. Now, if you don't have good control of your internal and external rotation of your hip, you're therefore not going to have good control of your knee, because your hip is connected to your knees. And so your knee position can't not be affected by your hip position. And so this exercise is going to be designed to strengthen the glute, because if you have a weak glute, what's going to happen is that your knee is going to go inwards, particularly when you do that squat and you bend the knees forwards. It's going to bring the knee inwards because it doesn't have that control, and therefore you're going to have this imbalance where your adductors are going to be stronger than your abductors, and this is what we need to correct. So there's 2 exercises that I would suggest for this. I would suggest doing both, because when we exercise a muscle in 2 different ways, we tend to get better results, particularly with the glutes. So what you're going to do is lie on your back with your knees bent and your feet flat on the floor. You're then going to just very simply bring your pelvis up, so then it should create a bit of a flat surface as you get to the top. Make sure that all the power here is coming from your glute muscles and not from your hamstrings. So you can focus this in your mind, and you can even put your hand on your buttocks to make sure that you're contracting these muscles, and try to not contract the hamstrings as much as possible. Once you're at the top, then hold for a couple seconds and then very slowly bring yourself down. Now, the most common mistake people make here is that they will drop down. So you want really good control, and you want to do it really slowly. This is the same with all these exercises. Do it really slowly. Now, the third exercise, what you're going to need is a resistance band just to tie around your knees, and then you're going to lie on your side with your knees bent to around 90 degrees. Put your knees and feet together, and then keeping your feet together, you're going to just separate your knee, your top knee, and bring it up. As you do that, when you get to the top, you hold for a couple of seconds and then slowly bring it back again. And you should feel that again in your buttocks, but probably more this time, you're going to feel it on the outside of your buttocks. This is going to be great for stimulating and activating the glutes. This exercise is called a clamshell, and the first one is called a glute bridge. So we got 1 exercise for the quads, and then we got 2 exercises for the glutes. If you focus on these 2 muscles, most likely you'll get some very good results. But as I said, you do need to get yourself checked so you can see exactly what's going on, and therefore get more of a specific treatment for you. So I hope this has been useful. Do give these exercises a try. If you like these kind of videos, then please do subscribe to see videos like this one twice a week. My name's Dr. Steven, and thank you again for watching this video. I will hopefully see you on my next one. Take care. Bye bye.